Good day, everyone. My name is Shana Yvonne, and I will be discussing the universal policy on COVID 19. So, the pandemic has exposed previously overlooked vulnerabilities such as inadequate health systems, gaps in social protection, and structural inequalities. And it also brought the importance of public health and strong health system and emergency preparedness, as well as the resilience of population in the face of a new virus or pandemic, lending ever greater urgency to the quest for universal health coverage, or what we call as UHC. So UHC is defined as a situation where all individuals and communities receive the health services they need without undue financial hardship. However, at least half of the world's population still do not have full coverage of essential health services. Ideally, financial burdens should be removed in order to access universal health coverage. But with economic recession, this might be a problem. Now let's discuss the threefold goals of UHC, which is first, equity in access. This means that everyone who needs health services should get them, not only those who can pay for them. So, this will eliminate disparities in accessing health services and promoting equity in access, regardless of your social status or geographic location. Next is sufficient quality. So, health services should be good enough to improve the health of those receiving them. So, if we're gonna receive care, it should be right at the same time and also having the best possible outcome. For the third goal, as what I've said earlier, there should be no undue financial risk. So the cost of using health services should not put people at risk of financial harm. Okay, so to continue, let's discuss the recommended actions for COVID 19. Number 1, urgently control further transmission of COVID 19 virus. This includes closing public places like schools, public gatherings, and also promoting stay at home requirements and restrictions on internal movement and international travels, while preserving fundamental rights, including access to asylum. So this measure has been effective in reversing the rising number of COVID 19 cases and deaths. It is also important to emphasize contact tracing, isolation, and COVID 19 testing. Our responsibility as nurses is to educate people to implement and support public health measures such as wearing masks, social distancing, hand hygiene to reduce local COVID 19 transmission, participate in contact tracing and isolation efforts to identify and isolate individuals who may have been exposed to the virus, ensure that COVID 19 testing is available, and provide care for COVID 19 patients to reduce the number of deaths, including administering appropriate treatments and monitoring patients' condition. Number 2, protect delivery of other essential health services. So, as a nurse, our responsibility is to continue to provide essential health services to patients, including emergency care, reproductive health services, and treatment for communicable diseases. Ensure the availability of medications and auxiliary services such as diagnostic imaging and laboratory services. So last is to prioritize the management of emergency health conditions, including emergency obstetric care, to minimize morbidity and mortality. Number 3, massively expand access to new rapid diagnostics and treatment and ensure future COVID 19 vaccines are accessible for everyone and everywhere. So, our responsibility as nurses is to administer vaccines when they become available to healthcare workers and eligible populations. Next, educate patients and the public about the importance of vaccination and address any concerns or misinformation. Also, support the distribution of vaccines and treatments to ensure equitable access for all. Number 4. Achieve universal health coverage. As advocates, we need to support the removal of financial barriers to accessing healthcare services, including COVID 19 related care. We should also assist with the suspension of user fees for COVID 19 and essential healthcare services, and to promote the idea that financial considerations should not deter individuals from seeking care, especially during a pandemic. Number 5. Strengthening national and global pandemic preparedness and aim for healthy societies for the future. So, what are our responsibilities for this? Number 1. Participate in training and preparedness efforts to respond to future pandemic. Next, collaborate with local communities, affected populations, and other healthcare professionals to enhance preparedness and response. And third, support the development and maintenance of standardized outbreak alert systems and the coordination of actions by national and local health authorities. Okay, so to wrap my discussion, UHC or Universal Health Coverage is built on foundations of equity and can be a powerful social equalizer if countries move swiftly to full population coverage in an equitable way. It has proven to be a catalyst for economic growth that benefits individuals, families, communities, businesses, and economies. Good health is both an outcome and a driver of economic and social progress. That is why universal health coverage is at the center of the 2030 agenda. So, achieving health security and progressing towards universal health coverage are not alternative courses of action. So, strengthening health system is core to both. Thank you everyone for listening. I hope that you have learned a lot from the COVID 19 universal policies.